Good afternoon, good morning, wherever everyone is joining us from. Welcome to the Physician Wellbeing Q&A series. I'm very excited about our session today. We have a very special guest. Um, this is how today's talk is going to flow. I'm going to mention a little bit about what the Early Career Physicians Institute is, do some introductions, some housekeeping rules, and then we'll get our topic of conversation going. So my name is Dr. Amna Shabir. I'm a certified wellness and life coach. Professionally and clinically speaking, I'm a geriatrician internist. I also like to emphasize that I'm an ex-primary care physician. At my heart, maybe I'll always remain a primary care physician. I am the CEO and founder of Early Career Physicians Institute. And today, this physician wellbeing Q&A series that you're a part of is one of the efforts that we're making to bring expert guests to our platform and talk about their valuable insights and the impact that they can have on physician well-being. And this is really why the Early Career Physicians Institute was founded to help help physicians thrive in life when they leave training and as they establish themselves in like the critical first 7 years of life. How do we do that? We offer coaching that is CME funds eligible. We also have workshops, and there are multiple free resources that you can access at our website, earlycareerphysician.com. Some housekeeping rules. This session is recorded, and there will be replays that will be shared. The platform that we're recording on is Zoom. If there's any specific concerns with that, please go ahead and check Zoom policies. You're welcome to place questions in the chat. Welcome to raise your hand as we go. I always like to emphasize with these sessions that you have a choice to maintain anonymity because I want to create a safe space for everyone to ask questions and be able to interact. I'll end with this disclaimer that this session is not intended to be any kind of professional advice, either legal, medical, financial, and it's solely for informational purposes. And with all of that, I am very excited to introduce our guest speaker for today, Dr. Manju Dawkins. She is a board-certified dermatologist who received her BA from Columbia University and her MD from the University of Maryland. She completed her dermatology residency and served as chief resident at Albert Einstein College of Medicine in the Bronx. She was also the assistant professor at Mount Sinai School of Medicine. She was twice named Teacher of the Year. I always like to mention these kinds of achievements because they say so much about a person. She has practiced in academic settings, private settings, hospital-based, and group practice settings in New York as well as Los Angeles. And very excited to share that she is also the co-creator, the creator and co-founder, my apologies, of Thimble, the first easy, safe, and comprehensive solution for alleviating needle pain and stress. So I'm going to stop sharing my screen and welcome her in. Thank you so much, Dr. Dawkins, for being here today with us.
Thank you so much for having me, and thank you for doing all of the work that you do, because, man, I wish I had that resource when I was in my first 7 years.
Thank you. I so appreciate your kind words. I would love to hear in your own words sort of your journey. And when I say journey, I almost feel like there are so many parallel things that are happening in life. There is your academic, clinical, professional journey. There's your journey into life and motherhood and all these things. And then there's your entrepreneurial journey. So however you want to pick whichever thread and weave it in and share with us, I would love to hear more.
Sure. Yeah, well, just to start off, I never thought I wanted to be an entrepreneur. Like, I just had no business in my blood or art or anything, really. So kind of ended up here in a very strange way. Always knew, though, that I wanted to be a physician. I'm the daughter of two physicians, and they definitely didn't force me into it, but you kind of like, you know what you see. And so I tried to think of all the other things I could do before choosing medicine, but it just was inevitable. And I think, I think something that I should mention, just given, introductions, and it always sounds so like, oh, wow, this person is somebody or whatever, but, there's all the backstory behind it. And so I grew up in Maryland outside of DC, and I loved basketball growing up, and I'm 5'2", and I'm tiny, and but I loved basketball, and I wanted to play in college, and when I got to Columbia, I walked onto the team. Nobody thought I would make it. My coaches were like, "Oh, I don't think this is going to work out for you." But I walked on and then, eventually ended up captain, which is crazy, right? Like but it was such a great experience to like find something that you love yourself, know that it maybe doesn't make sense on paper, but then just try to go for it anyway. Um, and then while I was at Columbia, my dean there was like, "You're not going to get into medical school. You should not apply."
Wow.
And so I was like, okay, but then I did it anyway. I was a teacher in New York City for a year, and during that year I applied anyway. And then I got into my state school, which is such a blessing. And then there, my dean said, "You're never going to get into dermatology." And and then again, I had to do an extra year of research, but eventually I got in and it's just that kind of theme has repeated, same thing. Oh, you're having a baby, you should not be chief resident. But you know what? It all works out. And so I I feel like that says something maybe about who I've been in the past and maybe who I still am, which is just like, oh, when someone says I can't do something, it just kind of lights a little bit of a fire and then it's about looking inside yourself and kind of knowing what am I actually capable and then just trying. If you fail, oh well, so what?
What I'm hearing is a lot of persistence and like this tenacity and grit, like watch me almost, and
Oh,
you're gonna
yeah.
try it, well, a little bit of smattering of self-doubt and just like getting over that's very interesting.
Yeah, that's so true, actually. It was up and down, like periods of extreme self-doubt, but also periods like, wait, I think I can do this. So yeah, it's interesting to look back and reflect.
Because a lot of times this just reminds me of what Steve Jobs said, that you can't connect the dots looking forward. You have to do it backwards. And a lot of times when I am talking with the physicians in training, like medical students, and I know last week was match week, which was can be extremely triggering and traumatic for many individuals. There's so much that doubt. How can I promise that belief in myself of what I will accomplish in my future, where right now there's no way. Like you had that in the shape of basketball, and I can't believe that, with team captaincy, and you mentioned it with residency, you mentioned it with applying, and all these. I just really appreciate and celebrate these stories, because the more we can share how nonlinear our stories are, the more space we create for accepting tangents and U-turns and going back and doing all the things.
Absolutely. Exactly. That's the problem with the resume. It looks like it's just like, but that's not real life. And we have to be okay with the hard parts too. That's what makes us go forward. So yeah.
So share a little bit about your working as a dermatologist. Clearly, you have worked in a variety of settings, so academic to private to all the places. And then you decide to jump into entrepreneurship. How did that happen?
Yeah, it was totally unexpected. I would say the seed of it started when I had my first daughter. I have two daughters, and when I had my first one, I was a third year resident in dermatology, and so I took her in for her, 1 month shots, and I just will never forget her face. She just looked up at me, just like, pain and like, how could you let that happen to me? It was just a moment of broken trust between mother and child, but also, between physician and patient. So it was like a really impactful moment. And I thought, like, that was terrible. I'm a doctor and that's the best I could do. I just felt like a bad feeling. And so, I was able to hack solutions for her and use EMLA and all of these things. But that moment was very important. And then 6 years later, when we were moving from New York to Los Angeles, I was talking to a friend in anesthesia and I was just saying like, and it was a moment of burnout for both of us, and I was like, we've got to do something. We can do something bigger and let's invent. And then I said the whole idea for Thimble and I was like, do you want to do it with me? And she wasn't ready, but it just felt like, hey, this is like a real problem and there's really something here. And I don't know anything about business. I didn't know anything, but it just starts one step at a time. And it was just like, okay, well, why isn't anybody else doing this? There must be like a ton of solutions. Like it's such an obvious problem. It's affecting every human. But then you find that actually there's really nothing out there. And well, what has anyone tried? And why have they not succeeded? And what are the barriers? And it was just one step at a time and realizing like, hey, there's really something here and this is going to help a lot of people. And it's just funny how things open up. I literally opened up an old dermatology textbook and I see this graph. It doesn't even matter what it showed, but it just made me think like, oh my God, there's a real possibility we can make this thing. Let's try. And it was just on from there.
That's so inspiring to hear. And I want to pause at the point where you mentioned that you were experiencing burnout and your colleague was also experiencing burnout. And to have something so magnificent be born out of something so horrifying. I
Yeah.
really want to go a little bit deeper on that. Like, what were you thinking? What were you feeling? Because with all the exhaustion that follows at that time, yeah, you have to have a very specific thought process. And yes, this had been in your mind that when the seed had been there.
Yeah.
Share a little bit more about that.
I think that's so true. It is from the hard times that like beauty is born. It really is every single time. So, and now especially I try to be really grateful because the hard times continue to come, but I try to be grateful for those times because I know that that's where the real learning happens and the real growth happens. Um, but yeah, I mean, I think, we all have this I just, you think of medicine, medicine really is a track. It's like this track that you get on really early in life, and it is a very long track, and you can't even see beyond it. And you have this idea that like, oh, well, when I just get into med school, everything's gonna be fine. When I just get into residency, when I just get, finally I'm an attending, I'm gonna like make money and it's gonna be fine. It's gonna be great. And every step you get, you're still kind of like, wait, okay, there's got to be something else. And so, especially when you reach attendinghood, I really thought I would kind of feel settled in life. And I think I was really disappointed and bewildered to feel very unsettled. It was almost the opposite because there isn't that same track, like you kind of had to lay your own track at that point. And so, um, and I think a part of it was, me having to know myself better. Like I shouldn't have put myself in some of the positions that I put myself in. I had to learn how to advocate for myself better. You know, I felt very much like a victim of the whole thing. And now looking back, I think I would have reframed things a bit. Um, but to be honest, that was a moment of mild burnout. I was okay. I wasn't, but there was a real moment of burnout that came later. That is what really propelled the business forward, to be totally honest. So, um, yeah, so I guess burnout is so hard, but I'm trying to be grateful for it. It is a real teacher. It is, and I talk about this sometimes, like to me, burnout is misalignment. The things that you're being asked to do at work are not the things that are in line with your core. And that's important to recognize and to take yourself out of that situation if you feel like you can't get back into alignment in the place that you are. So yeah.
That is so much there. I really want to pick on the word that you mentioned, which was bewildered. You
Yeah.
mentioned that you felt bewildered, that here I am, I've done all the things, I've been on this linear track, checked all the boxes, but I am bewildered that it's not all that I thought it was going to be. And that feeling, and I've previously mentioned personally for me, burnout was almost like heartbreak
Yeah.
because we love to have like this is the WHO classification, this is the other classification. But how do you know you are burnt out? And absolutely like that misalignment and lack of autonomy can be
Yes.
very real. And I think one of the worst emotions to feel as a human is to feel powerless and to create something so beautiful. And of course, the when the fire got worse, that's really what propelled you to jump into entrepreneurial waters further. So let's go there. So you're now stories moving forward. Now you've decided that you're going to act on and create this. Share all the details.
Yeah. So, when we were kind of in transition from New York to Los Angeles, kind of started looking into it and really started simply with just Google and like I said, figuring out what else is out there, what are other people doing, what have other people done, what would I do differently? And because that's one of the things that I think is so important is when you're going to build your own solution, we all have self-doubt, but it's important to recognize that whatever you build, nobody else was going to do it like you
Mm.
ever. And so if you continue to follow your own instinct, you will create the right solution because it's yours. And so, anyways, so kind of looked around, eventually found a CRO who was amazing to work with. And that's just a series of Google spreadsheets, like calling all these people all over the country and world and figuring out where the right fit was. And then trusting instincts about that because again, with medicine, you think very logically and but I think you can't be fully, is it left-brained? In entrepreneurship, you have to use both sides. You have to use your gut, you have to use your instincts. And so I remember like really trusting how I felt on each call with each one of those CROs. And I'm so happy with the CRO that we ended up with. They're amazing people and we're still friends. Um, and but I was still working, essentially full time. And so there wasn't really the space for, things to fully expand. And also was, you know, it was just it was a tough time. And, there were probably a lot of signs that I should have made a change. And I tried to push them down and push them away. And eventually it just became like very clear that I had to leave. And I jumped, full on. I actually left medicine for and what ended up being 6 months. I didn't know how long it was going to be. I was just like, I'm just going to go for this. I'm going to go hard at Thimble and see where it goes. And it was honestly probably the most beautiful 6 months, career-wise that I can think of because whereas sometimes medicine makes you feel can make you feel really small and just closes you in. This just felt like expansion. Like you're just talking to people and it's just that. You're just talking to people and you realize that everyone's not against you. Everybody wants to help you. Everyone wants to help in their own way and they want to be part of something creative and new and exciting also. And so it just reframed my view of the world, quite honestly, and made me fall in love with people again. And it was just really wonderful. And now I feel lucky to have been able to come back to medicine. I do practice very part-time, but I do practice and I have come back with just a different like love of people because for me it was always about the patients and the interaction with patients and so I feel grateful to have that again.
Wow, that's so beautiful because taking that perspective, like there's so many learning points in what you've shared from. I love the word that you used about opening and expansiveness and that feeling of being boxed in, which is very real because this is the box that medicine has created for you and you have to fit in and really perpetuates that black and white thinking. Well, this is the morally correct way of practicing medicine, which will almost always lead to burnout. And then when you are burnt out, then you start questioning who you are as a human. What's wrong with
Yes.
you and
Yes.
not what else can you do? So at that point, it's like, well, definitely for self-preservation, you want to step back. You want to create that white space. And everything you just shared is exactly why I've been trying to have these conversations and these Q&A series, because the answer to burnout and physician well-being is so many different things that we can do. And one of this is entrepreneurship. And thank you for modeling that by stepping away. You created space for yourself, you created space for your thoughts, and you're back and you're helping patients in this. And I always like to say you're back because it felt aligned to you. If it doesn't align to someone, if you need a longer sabbatical, if you need a break,
Yes.
if it there is no like one correct way to be.
Exactly. You just have to keep listening to yourself because maybe medicine wasn't the right choice anyway, or maybe medicine in the way that we have to practice these days isn't the right thing, and that is okay. There's so much more out there than, like you said, that little box. Oh, yes. And it reminds me of because we're told that. I mean, we are told all the way along training that you're bad at business and so that's why you should be employed and that you'll never understand this and we're told to remain small and I think sometimes intentional you know that's how you control people, is you try to make them feel powerless, but we're never powerless. That's not true. And so, one thing that, physicians definitely have, I mean, it's a long road. So everyone has grit. Everyone has the ability to learn things. So that means that should teach you that you are capable of really doing pretty much anything you want to because you've proven yourself. So if you can just tap back into that and say, okay, I've gotten this far in life, I can keep going.
Absolutely. Yes, that feeling that, oh, you're bad at business. Like you don't know about these numbers. You stay in your lane, right?
Mhm,
Stay in
mhm,
your lane, go see your patients,
mhm.
do all the good things you learned in Durham, and don't think about the entrepreneurial space, which kind of brings me to this next question. And I really want you to share things that really worked in your way, that being a physician was actually one of the biggest strengths, maybe. I mean, other than being a dermatologist and really understanding the pathophys and everything that was happening and witnessing firsthand. You mentioned that fracturing of the trust between patient and physicians, and um, I mean, I've heard to other talks that you have had, and you have shared previously what a big problem actually needle phobia is. And
Mhm.
I would love for you to expand a little bit about the problem, your
Yeah.
solution, and how being a physician was really a strength.
Yes. So needle phobia now affects over 60% of adults, according to the latest study, and that has grown sixfold. So back in 1995, the rate in adults was considered to be 10%, grew to 22% in 2012, and now it's up to 63%, but we're not talking about it. And it just reminds me of another part of like in medicine where we don't get to question things. We have to just believe what we are taught and operate from that place. But when something just doesn't like seem right, we should always question it. So anyway, so learning that was just is it continues to be just mind blowing about what a huge problem this is and how we don't have the space to offer solutions for it. Because I think, for me, and everybody practices medicine differently, but I like to spend time, and especially in derm, it's volume driven for the most part, so it's hard. And I just think with less and less time with people, we don't have the opportunity to offer, the compassion and empathy that people need sometimes. And I think with needles specifically, we're giving so many of them as physicians and all healthcare people, right? It's just constant. That's what every medical procedure pretty much starts with the needle. And so we kind of have this thing like, okay, let's go. We got it next, like we kind of rush people through, but it can be so traumatic for people. And my own daughter has had developed a severe phobia later because of a really traumatic experience. And this happens to so many people because we get so many needles, which is a wonderful thing, right? Like, when I was a kid, I got 6 shots before the age of 6, but my kids have gotten 36 shots each in the same time, which is great, right? We have better vaccines, better treatments, all of these things. But if we don't treat that experience with a bit more care, we end up with a bigger problem. Um, and so I do feel that my experience as a physician was so important. And that's why I really advocate for more healthcare people creating solutions because we're the ones seeing the stuff every day and seeing the interaction and feeling what it feels like to do this. And for me, feeling what it feels like to do this to other people because I don't like to make people uncomfortable or have them be in pain. It hurts me. Like that's just part of my makeup. Like I am an empathic person and I don't like that feeling. And I reflect on how it makes me feel bad as a physician. And it probably was a component of, some kind of burnout also. Anyways, I say that all to say that I think my experience both as a physician and as a parent and as a patient, because I also hated needles as a kid, really helped me form the solution that I think would be helpful for me as all of those three things, and then hopefully helpful for other people. Um, and so that leads you to the next step. So you build your own solution, that follows your heart, but then you talk to other people around you and make sure that somebody else is going to be interested in what you're building also. So yeah.
So there was definitely identification of a needs gap, which is huge. And I mean, you are the first face of needle phobia concerns that I would say like I can place. Like I honestly never even thought in depth about it as a physician because you're thinking about like procedures that are so extreme that you forget what is happening every day. Everyone is getting a blood draw. Everyone is getting shots. This is something so regular. Why are we not talking about it? So there is an obvious gaping need that's there for compassionate care, and you identified it. You played into your strengths, and I love that last part where actually is there a market for it? Because you can have all the great ideas you want to, but then if no one's going to come get your idea, what's the point?
Right, exactly. Exactly. And actually, and I am definitely not the first to work on this problem. I just want to call that out. And that's what's so interesting because it takes, you know, generations of people and there and have been many, it's mostly women who have done the research on this. There's an amazing pharmacist out of Canada, Dr. Anna Taddeo, who has really done incredible research for decades on this. And Dr. Amy Baxter invented the Buzzy, and she's a ER physician from from the southeastern United States. Like, and there are these all these child life specialists and nurses. I mean, there's like so many people who have like laid all of these bricks. And I just am here at this point in time laying my own bricks. And I don't know where it's going to go, but I feel like it's the right place to be for me at this point. So we'll see.
Acknowledging all the other people that have been on the same journey and have been working towards solution, it really plays into collegiality and expansiveness as an entrepreneur, and really, I think speaks volumes to your abundance mindset. You're acknowledging, you're reflecting, and you're recognizing that this is everyone's working towards a good solution, and that when you mention like this is a unique solution that you're offering. And so before I keep going further, I really would love to learn a little bit more about the product themselves.
Yeah, so it's there's so many things about what you just said because the research of Dr. Taddeo really showed that multimodal solutions work the best, meaning you treat from different angles and you get a better result. And so we have developed a patch called Prepare that you apply before any needle procedure to prevent the pain. And that's a drug and adhesive lidocaine-based patch that's specifically designed and formulated for needle procedures. And then to follow, we've developed a Recover patch, which is actually a patent pending plant-based patch. It utilizes turmeric and arnica, and you put it on after any needle procedure to alleviate the bruising and soreness and ache that you tend to get. But we all know that pain isn't just physical, it's also emotional and psychological. And so that's why we pair the patches with our app that puts together all the research-backed techniques and tools that have been kind of outlined by those other folks that I mentioned, like, distraction, applied muscle tension, cognitive behavioral therapy techniques, breath work, and we just put it into an easy-to-use tool to help get people through. Um, and yeah, it just we're trying to just combine all of the things that we think we can help with in accessible ways. So one of the things that I feel is important is that not everyone has access to a lot of the solutions, right? People's pain is not treated the same. We know that women and people of color's pain is diminished. And so that's why it felt very important for us to create solutions that are available without a prescription. So that is part of our mission is everything we make is available without a prescription. Um, to hopefully help get people through. And like this idea of multimodality, it just like based on what you just said, it just feels like so important. Like you can't build anything on your own. And you can't create a solution that is just singular. You have to, if you're solving any problem, it's the solution's always probably going to be somewhat multimodal. And same thing, I definitely didn't do this by myself. I have this team of people around me who have different expertise, and that's the only way these things can happen. And sometimes it feels like in medicine, like you're the doctor and you've got to figure it out on your own. And like, that's it. And that's not how real life works, I think. And yeah, just acknowledging that you need help, I think is partly the first step. So,
Such great points. I'll speak to the last point that you made first, that you're expected to know everything. And
yeah,
as I work with early career physicians, and we're starting after training is done, you think that you're supposed to know everything.
yeah,
Where and really with the work surrounding imposter syndrome and so many of those overtones, well, here you are now as an entrepreneur. And I'm curious to know it, at the time when you were beginning, how was your imposterism happening at that time? Were you experiencing anything like that?
Oh, definitely. I mean, I still experience it, except that the beauty of it is I feel like my what another one of my what's I guess strengths was that I knew I didn't know anything. So I just was okay with being a complete beginner. I was like beginner's mindset all the time. But if you can maintain a beginner's mindset forever, like you can't ask dumb questions because you're a beginner. You get to ask all the questions all the time. Um so I feel like that was a real blessing to know that I did not know what I was doing. And then and like I said, people want to help. And I've been able to do these accelerators and things like that where they teach you, they teach you the words of business and they teach you how to raise money and they teach you how to build a deck and all of these things. And what one thing we know about ourselves is we know how to learn things. And so I just keep trying my best and we'll see where it goes.
You're not afraid to ask for help. You're not afraid to create a team. You're not afraid to know what you don't know and actually lean into that. Like I love beginner's mindset because that's it. Like what if you took away the shame and perfectionism from the
Yes.
fact and we could apply it into pretty much every facet of our life from being a physician to being a parent to now as an entrepreneur, you're saying that. And I also really want to honor the fact that you have created such a phenomenal product in terms of like there's a need. It's multimodal. When you explain it to me, I understand it. A lot of times you're like, well, that sounds really good, but I don't totally get
Yeah.
what the product is, but I totally understand what you're trying to offer a great solution and the patent process is there as well. So there's so much that you've shared. I want to take a quick pause and now think of this prospective physician entrepreneur. And let's, for the sake of our conversation, think that they're an early career physician. How would you think that maybe as an early career physician, maybe there are slight overtones of burnout, maybe there's some well-being concern, but more so there's this fire like, I think I have something in me. I think I have an idea in me. What would you say to that person? What are your recommendations?
Oh, these are not my words, but somebody said to me, well, actually, it was written down and it was just simply move towards expansion. And
Mm.
it's so simple, but it's so impactful. So, because there's those things that you're like, oh, I should do this, but like the inside of you feels like crumpled and you're like, ugh. And then there's some things that you think about and you're like you're just insides light up. And the advice was just keep moving towards that. And just what you described in that individual, whoever it is, like they have to follow the fire. Like you have to honor yourself in that way. And it sometimes just doesn't make sense. But I just don't think it ever leads to anything bad to keep trusting yourself and you can do many things at once. I mean, it's obviously hard, but you don't have to throw the what's that idiom? Throw the
The
baby
baby, the bath.
bathwater. Yeah, exactly. Like, you don't have to be like, I'm never going to be a doctor again. I'm throwing out medicine forever. Like, you've trained for this. You can always come back to it. And but why not explore? Why not see what else is out there and kind of do it with a full heart and like a little bit of abandon. I think when we kind of tiptoe and like halfway do something and then we see a little bit of failure, then it makes us run back to safety sometimes. But sometimes I think you just have to like let go and just like try it and see what happens and you'll probably surprise yourself. At least that's what's happened to me. I just reflect on it. I'm like, how did any of this happen? It's so magical and wonderful. It's not like I'm swimming in success or something like that. There are so many steps in front and the road is so long ahead, but I don't even look that far. I'm just like right here. And I'm like, wow, this is so fun that I even get this opportunity. And that alone is, worth it.
So there is a fire, there's a thought, and that feeling that you've mentioned, not dread, but more so expansion and moving towards that, really going towards that. But I love how you said, yeah, try it out. Like what I also, one of the words that and phrases I love to work with my clients on is saying, what's the worst thing that can happen here? Like, you have an idea. What's the worst thing that can happen? And I definitely will underline that statement about the baby in the bathwater, because often we feel that either we're cheating on our medical career by having entrepreneurial thoughts. Like, you are not, again, coming back to that box where you have so cozily accepted that you're going to be squished and fit in. It's okay to break that box. It's okay to go and explore, and you're not going to lose your way, your righteous way. You can come back. So I love all those thoughts. Thank you, Manju, for sharing that.
Such a good point.
Yeah.
It's just about like, because we it's not even just you feel that way, because there's messaging that comes towards you like, you know, we invested this much education in you, you should see the patients, and you owe, you know, and I understand that, but we also owe medicine and healthcare solutions. Like some of us have to create new things and keep pushing the ball forward. And so I reject that kind of sense that like, you go back in your place and go see the patients, you know. Yes, that there is immense value, and that is like the real work, but there's also, everyone has a different role, and you have to follow your heart, and that role might take you in weird places, and go there.
Yeah, don't worry about, don't be
Yeah.
shy to go to the weird places. It's okay. I will also say that people, we all love numbers and objectivity and metrics, and like that makes everything like evidence-based. Well, we have enough evidence to suggest that you're going to burn out by forcing and pressuring yourself to be in a place and space that's not aligned, as you mentioned earlier, or it's not authentic, or it's not feeding you, and you're feeling disconnected. And it's really surprising that a lot of the time I'm actually doing work surrounding purpose and fulfillment, and
Mhm.
you're not feeling fulfilled. So if there's something else that's calling you, it can be in medicine and it can be outside of medicine as well, right? It's okay to honor that, because statistically, if you don't, you will burn out and you
Yeah.
will leave medicine.
Mhm.
Early career physicians after residency typically tend to stay in their first job for less than 5 years or about 5 years, and then they'll leave. But, and this is that feeling like something's wrong with you if you do that. There's nothing wrong with you. There's nothing wrong with you for having a dream and like going to go and try out that dream.
Yes, absolutely. Absolutely. Yes.
So I imagine now this person has a dream and they've decided they're going to go and pursue this fire. What is like, you know, some of the thoughts that they have that are still limiting them? And I will just say that out loud, like debt and financial stability, right
Mhm.
off as you are done with training in the first couple of years. Any thoughts surrounding that that you would maybe have some advice specifically?
That is very real. And that is very real. And you know, I think about that now, you know, it is a big, big financial risk. And, you know, I was a little bit later, you know, I had practiced for a few years, so invested savings and things like that. And it's just, it is a big risk. Um, and I think depending where you are in life, sometimes you're just like, I don't care. I'm going to try it anyway.
Yeah.
And I think that's where I got to be. But you don't have to do that. You don't have to put yourself at risk. You don't have to put your family at risk. And I'm not sure I would recommend that any of them do like, you know, what my family did. You know, you can raise money. You are, if you're a person in healthcare, if you're a physician with experience, with that much grit, the venture capitalists of the world, you know, the investors of the world are realizing that, wow, these people know what they're doing. Like they have real experience. Like they, you know, yeah, this solution didn't just come out of thin air. Like there's something real there. And so people are looking for that. So um yeah, you can raise money. You don't have to take out personal anything. And then and give it a try and build yourself a team and just start slowly, because I think there's a lot of resources out there now that kind of teach you about how you can you know, shortcut your startup, all of these
Yeah.
things. It's just like a lot of customer research early on. And frankly, if you're making something in healthcare, your job is customer research, right? You're talking to patients every single day, and you're probably seeing the problem you're talking about every single day, and that's part of it. So don't discount that. That's probably your real value. Um, Yeah, it's funny. All this is making me think of like, um, how your own like roles in life are what help you. And, a lot of people think, oh, you're a mom, like that must be really hard. And sure, there are hard things, but it's also what makes it easy because I was reading a lot of picture books to my children all these years, and I love picture books. And there are great lessons in there for us adults in these picture books. And so anyway, so if you're thinking of starting something, please go read that book, What Would You Do with an Idea? Because the words and the visuals are, I mean, I went back to it later and I was like, wow, that it really captures. It's not even just entrepreneurship, but any idea that you have that you follow through with, it literally is like birthing this beautiful bird that takes off and flies. So yeah, um, a little bit off track, but I just think like even the things that you think are the parts that is going to make it hard for you might actually be the thing that makes it easy.
I love that answer because I think there was so much creativity. You would also be our first guest expert who has recommended a children's book, so I'm all over it. I love that because often, if you're having an idea, it doesn't have to have a very concrete, clear solution, which is also, it can be unnerving. It can be a little bit queasy and make you want to vomit, but that's okay. And the answers are out there. So you can outsource funding, you can crowdsource funding, you can look at different things. I would also I'll put the link to the book in the replay as well. But I find that all expansive that you don't have to wait. You don't have to wait if you are sitting on an idea. Get curious and brainstorm.
Mhm.
And there are people out there that can help you, they can support you, they can guide you. So that fallacy where you have to like sit and invest your time and not do anything, I think this we have enough conversational data today and people proving us wrong every day that you can just literally, as Nike says, just do it. Like just
Yeah.
go try it out. What's the worst thing that can happen? Of course, we're not endorsing risks, but you are smart to begin with. Why, as a physician? Like, think of it this way. You are not like the biggest risk taker on earth, so you have to lean into your trust because of all your life's trajectory has been based on very sensible decisions. So I
Right.
have faith in you, you know.
It's so true. It's so true. Oh, gosh, when you're saying this, it makes me really reflect on like the long track of medicine just slowly makes you start to not trust yourself, right? Because you are listening for all this external validation and you just do what you're told and you meet the needs of everyone else around you. And so it's really hard to listen to yourself, but I think that's why it's worth it to find yourself, because otherwise it can lead to really kind of dissatisfaction in career, or we're just burning out completely. So it's worth
And
it.
and as we say that, these are like real things like burnout and the Medscape reports are all there. I'm not going to rehash the stats, but I always say this, you have to live your life right now. You have to live authentically in alignment and stop delaying gratification any further. Like, come on,
Yep.
you're here. And if you have a great idea, why not start? And so now we have that same metaphorical physician that we're talking about. They're ready. They're ready to brainstorm and think about ideas. What would be some recommendations that you would say, like, here's what to do and start? And I know that this is very broad because it lands on the kind of idea, but we can say healthcare, for example, if it's a healthcare related or healthcare tech related an idea. I would love to hear, like you could say, here's what I would recommend starting out with, maybe three, four things.
Yeah, I would say, I think first thing is just sit, give yourself space to just totally go free with your idea and then draw it or write it out. Like draw it clear, like actually putting it on paper, I think is really important. And I remember the moment that I did that also, and it's like etched in my head, you know what I mean? And there's just something to getting it on paper. And then start talking to people about it. And then you'll kind of get a sense like whether you're onto something, whether you're not. And so it's talking to all the stakeholders, which initially I thought the stakeholders were only patients or, and and now I'm learning that there are so many stakeholders with healthcare things. So it's like, yes, it's patients, it's of course physicians, nurses, everybody in healthcare, but then it's also, okay, who's paying for it? The insurance companies, the hospital administrators, da, 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 da. So it's like there are many people to kind of consider. In my opinion, with healthcare solutions, we should be focused on patients and the people delivering care. Healthcare people, I think that should be the center and core. Um, but it's important to consider everyone. And then I would say after you've kind of formulated what you think the solution is, then go look at Google and look at what else is out there.
Mm.
Because I feel like it's important to go in that order so that these things don't color what your vision is, and also don't discourage you. Because sometimes my husband says this. He's like, there's more than two companies that make pants, because sometimes you might see like, oh, somebody's already doing something similar, but they're not doing exactly what you're doing. And sometimes people need different pants, or like, you know what I mean? Like there might need to be a tweak on a solution that you're really hitting on something. So anyway, so that's why I think it's important to figure out what else is out there, and then figure out what they're doing right and what they're doing wrong. Like for our things, there were people who tried to make injections less painful, and they use things like ultrasound, and it just ended up being too expensive for certain people, or maybe they were targeting the wrong people, and it's too expensive to change prescribers' minds. So maybe going the pharmaceutical route was not the a way to do it. So there's lots of things you can learn from digging in and figuring out why there was success or not. And then beyond that, I think what's nice also about being a physician is we've probably touched at a lot of different institutions, like different academic institutions. And these institutions are recognizing that there's a lot of value created at these startups, right? Not all of them are going to succeed, but they see that there's a lot of upside in investing early. So a lot of the universities will have these accelerators that are sometimes free, and you can just give you an education so that you feel a little bit more confident, talking to investors and things like that. So seek out those um, resources, and then just talk to as many people as you possibly can. And it's just so much easier with Zoom, and most people are just happy to take like a 15, 20, 30-minute call with you. And um, and I think the path kind of just starts paving itself for you.
Wow, I would have not thought about the accelerator bit that you mentioned, especially at towards the end in terms of like universities having programs and offering, and I think that's something so valuable to know. I also love the fact that you said have your own idea untainted and colored by all the things that are out there, and so you have that laid out first before you go onto the internet situation and then trying to like demotivate yourself and knowing that only you will have your idea. Like there's
Yeah.
absolutely so how you're offering an inclusive evidence-based multimodal solution to needle pain. I think that's beautiful. But if you had decided to not do that, and just be let down maybe by other products that are out there. So I think that's really good to know. Um, I would also love to hear any red flags that you would say.
Yeah.
Um, I'll combine two of the questions
Yeah.
together. So however you want to lay them, is it red flags and biggest mistakes, or something you want to just share not to do?
Yeah, when I mentioned the accelerator thing, there's a lot of accelerators that will take equity and things like that, which sometimes they can be really valuable. So the big name accelerators like, Y Combinator and things like that have value, and they will take a chunk of your uh, company. But so you have to think about what stage you're in. So I guess what I would say is, to physicians who are listening, don't be afraid to go to these big accelerators early on, because before you've even created, because I think, well, I know if you think about mistakes for me, like sometimes I'm just like, I was waiting until I had something that until I waited until I had this before I would go out into the world and before I would talk to this person right before. And I don't think you should wait. I think you should get out there early, because before you've invested too much money and time and this and that, you kind of want to get those big names on board early. And it makes more sense because I think for me, for example, it's like, wow, already, had our pre-seed round. And so to go to one of these accelerators now, it's like, oh man, be giving away a lot for what, So anyway, so I would say go early. Um, and don't be afraid to talk to people because a lot, I've been doing this quite a while. And early on, I was afraid that people would steal the idea
Mhm.
or, and so yes, that's another tip. Provisional patents are relatively inexpensive. So you can write your own provisional patent, and I think it's like $100 or something to submit. Um, Also, you can talk to a patent lawyer, and a lot of times they'll do consultations for free, to just kind of get an understanding of like if you're on the right path and things like that. So think about all of those things too, and protect yourselves in the way that you can, but also have confidence that, like we said, no one's going to build the thing like you are anyway. So if somebody wants to steal your idea, go for it. It's really hard. And it's going to take them just as long as it took you anyway. So so don't be afraid to talk to people because you just learn so much from all of the people around you and from places that you don't even expect it. Um, yeah, so I think those are the big thing. I mean, people get funded for paper napkin ideas, they really do. So I say get out there early. Don't wait as long as I did.
You're really beating the drum that we all physicians suffer from, that perfectionism. Like,
Yes.
everything does not have to be figured out. First of all, you don't need to know everything.
Mhm.
You have the idea, and really reminding it to trust ourselves and going out and yes, doing what you can in terms of like the preliminary patent and protection that you can, but really not stopping yourself. I'm forgetting who said this, but don't be the world's best kept secret. Uh,
Yeah, that's
so
good.
go ahead and share. Um, such great points over there all the way. And you, if you had to like now this person's ready and like they're taking the plunge and all the things are happening, what are just in general with your whole journey and when you look at early career physicians and maybe physicians at large as well, what you would say would be your top takeaways from your this entire journey like you want to share with us?
Perfect is the enemy of good. I say that a lot now. Um, I mean, yes, I have just learned so much about myself and about everything through this whole process. And like you can even hear it, like I was talking about, it just reminds me of how fear-based I was early on in the process and like holding back. And then what you see in real time is like when you let go a little bit and you share and things just grow exponentially faster. And so it's like this positive feedback loop that shows you that it's okay to be open and it's okay to be vulnerable and figure out and follow your own heart. Like for me, like what I was saying in the beginning, like I just was always a person who yeah, I don't like pain for myself. I don't like pain putting pain other people in pain, and that would harm me in residency and in right, like I take longer with people. I was kind of like, ooh, do we have to biopsy that kid over there? Like she's probably fine. I didn't want to, and I just thought, man, this is why I'm so bad at being a doctor. Like, man, but no, 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 I'm just a person who is empathic, and that is okay. And now I get to lean into that. And then people would say like, oh, but in business, don't you have to be like cutthroat and this and that? And I do not believe that's true. I think you can absolutely be empathic and compassionate in business. And I think that's where like wonderful things happen when you're just coming from a place of trying to understand what the other person is saying or like what their perspective is. Like I feel like that's the solution to so much. So, um, anyways, I feel like I just want people to trust themselves, and it doesn't mean like go start a business, but even in medical practice, because I do that more now. I think that's why I've been able to come back and love it so much more, is because I'm not afraid to be like, they'll be like, why is this happening to me? And I'm like, I have no idea. And I just say it with like full, like, I really don't know, which like before I would have been like, I have to pretend that I have some semblance of like, but people, I think, respect authenticity. Like they get it. I'm like, well, she's being honest with me, it's a breath of fresh air for everyone, I think. So I got off topic. I forgot what the original question was.
No, you did share a lot of takeaways. It was like just entrepreneurial takeaways from your journey.
Yeah,
And I really think that trust is such a big one. And
Yeah.
It reminds me almost of the thing when I started as a primary care physician in the first couple of weeks. Like when I wouldn't know something, and right before my job started, the last rotation I had in internal medicine was the MICU for like very long. So of course, everything I felt like, oh, everyone needs to be intubated situation. But I would look at the patient and I would say I don't know. And I would say, like, I think you should be really worried if your physician pretends to know everything, because there's no physician who knows everything. Medical science is evolving every minute. And yeah, sometimes I would pull up to date and search the topic, and I would move the screen towards them and then would say, like, let's look at the answer together.
Yeah.
I know where to look for and I will get the answer for you. But right now, I don't know the answer.
See, you should be an entrepreneur like that. That's okay. I mean, you are an entrepreneur. Like that is what you're doing. And exactly that. Like it's okay. None of us know the answers to everything. And same thing, like with parenting, with everything. Like we don't have to know everything. Um, yeah. Vulnerability is a good thing sometimes, most of the time, I think.
It really is. Thank you so much for today's conversation. I know that you've taken out special time and to be with all the early career physicians, and I really appreciate everyone who's going to be watching the replay. And this will also be posted on different platforms for everyone to access. I really, really appreciate your time. Thank you, Manju.
Thank you so much for this opportunity and thank you for all the work that you do. And you're just like really changing the world. So thank you.
Thank you.